This conference will now be recorded.
All right, I'm on the last best part. That was what everybody's waiting for. The last of my review recordings. This is for adult daycare administrator issues with the review of the health department rules and statutes that relate to adult daycare. It's titled G310, Chapter 605, and Title 63, Sections 1-870, and so forth. So this is applicable, as I said, only to nursing home administrators who can do adult daycare and adult daycare administrators. If you're a residential care assisted living, or certified assistant, this is not the review for you unless you're morbidly curious for some reason that I don't understand. But you're welcome to watch it if you want to. But without any further ado, we'll get right into the review for the adult daycare people. Like we always do, we start with the definitions. Looking at the ones that are kind of unusual here, we have adult daycare aid. That's defined here, and there is a difference. We'll get into that later. Adult daycare aides are not the same as CNAs necessarily. We have a definition of basic daycare services, which is new, and they've defined direct care staff to be paid and volunteer. That's kind of a stick out thing for this, that if they're assigned to take care of the direct needs of a participant, and a participant is another difference where everyone else has residents. These are participants in these programs. And so those are ones we would want you to look at. The other thing we want you to look at is the participant rights. That's all of paragraph 3-1, but apparently I'd bring your attention to paragraph 10 in there that says that all the participants have the right to have access to telephones to make or receive calls unless necessary restrictions are indicated in the individual care plan. Because there are those people who will pick up the phone and call 911 or something, and have people descending upon your building all the time. And if you have those kinds of people as you're among your participants, you probably need to get the care plan to say that they should not have a phone in their possession. So anyway, that's something you should always be familiar with, is participant rights as the administrator. So moving right along to subchapter 5, paragraph 5-3 talks about the inspections that go on in an adult daycare center. The department shall at least annually and whenever it deems necessary inspect each adult daycare center to determine compliance with the Adult Daycare Act. Sanctions are listed under 5-4A and B. It says the department may deny, suspend, deny renewal, or revoke the license for the facility. Again, these are facility issues, not your license. The health department cannot take your administrator license. That's our prerogative to do that. But they can take action against any person who has been determined to have violated any provisions of the Adult Daycare Act or any rules or regulations issued pursuant thereto. Paragraph 5-4B says that's a penalty not more than $500 for each day that said violation continues. And if you're a nursing home administrator and you heard that, and you heard the residential care penalties that had a ceiling on it, this one does not have a ceiling, so there's another difference. And again, there's numbers already popping out at us all over the place there. 5-4 or 5-4A and 5-4B in 310-605. So moving on to chapter 7, which is organization and administration. We'll spend a little time here. It looks like we got a few things to note. 7-1A talks about the governing body and the functions. It says the adult daycare center shall have a governing body that has full authority and responsibility for operation of the center. That sounds very much like the definition of an administrator, actually. And if we look at 7-3B, it says the director, which is what they call administrators in an adult daycare. The director shall be given full authority and responsibility to plan, staff, direct, and implement program for day-to-day operation of the center. So there's a fine difference between the governing body and the administrator in the definition there that you have to pay attention to. Back up to 7-2, it is the responsibility of the governing body to designate a center director who manages the center. Paragraph 7-41C says that the center's enrollment policy shall prohibit enrollment of persons whose needs exceed the capability of the center's program and persons excluded by the Adult Daycare Center Act. Again, if they don't put that in writing, then there's no violation. If you let someone in who needs ventilator care, for example, that's really not someone that you're going to find in an adult daycare center. Big difference between adult daycare and everything else. Adult daycare is all about activities, and they come in the morning, they leave in the evening, and they're there for the activities. Nursing home, they're there for the nursing. Assisted living, they're there for assisted living, assistance in what they're doing. Residential care, they literally, that's residential care. They live there, and that's a different thing entirely. 7-43C talks about, well, let's back up to 1C and 3B and 3C. Services may be obtained on a fee basis, but are not included in basic services, and you have to disclose your fee schedule. Paragraph 5 says medication storage administration. It says the center shall have written policies and procedures governing the storage, maintenance, and administration of medications as stated in section 310, 605-13-2. So we'll get to that apparently. It comes up later, but it tells you that you have to have it. Admission and discharge, they've defined some of that there. Paragraph 6A2, we're in 7-4, 6A2, says the requirement for a current medical report and medical assessment by the participant's physician to be obtained within 5 working days of admission. I've mentioned in other briefings that some of this stuff is influenced by lobbying, and this is another one of those cases where they can allow someone to come into a adult daycare center for up to 5 days before they actually admit them, just to let them see what goes on there and see if it's something that they're interested in. So that's the root of that 5 working days that they allow that to happen, where they don't have a medical report on the person for up to 5 days. Personnel record system, paragraph 8. I'm on page 9, by the way. Personnel record system, a personnel record shall be established for each employee and each volunteer counted in the staffing ratio. That's the difference. Again, we talked about earlier in the definitions that they count, that they have, direct care includes volunteers. And this is where it tells you more specifically that the personnel record is maintained for each volunteer. That's counted in the staffing ratio also. General records, records of any incident or accident involving a participant shall be kept and maintained. Again, that seems pretty logical that you would have to do that. Participant records for social services and medical information shall be maintained. Paragraph C, all records may be kept and maintained electronically. Well, I think they mostly are now. But a backup of the computer system shall be maintained. That's what it says there, and that's when that was written. That was probably a good idea. The employee and participant records shall be retained for not less than 5 years. It says employee and participant records, not less than 5 years. After the employee's discharge or the employee's the participant's discharge or the employee's termination. And then we've got a section on 7-5 that goes through residential and visiting pet issues. You have to have written policies if you're doing that. Paragraph 2 there says that you have no more than 2 dogs or cats as residential pets unless you have received prior approval from the department, as stated as a special program pursuant to this chapter. You have to ensure non-disruption of the center. You have to have proof of rabies. You have to have a statement from the veterinarian saying that they don't have communicable diseases to humans. Proof of evaluation by a veterinarian. Lots of things that you have to do. If you have a bird, there's some specific things for that. And resident pets shall be the responsibility. This is paragraph 7-5-7. Says resident pets shall be the responsibility of the director's designated attendant. So hidden in that, and again, this says director, and again, that means administrator. So your ears should perk up Residential pets shall be the responsibility of the director's designated attendant. That says basically that the director is responsible for appointing an attendant for those pets. So make sure you do that. Pets are not allowed in the kitchen. That's in paragraph 8, 9. Actually, it's in 9. Not allowed in the kitchen, dining room, or areas used for food storage or preparation, dining, medication preparation or administration, or clean supply storage. Paragraph 10A says that you may allow pets into the center, but they have to be under the control of the person who is bringing them. Okay, so be familiar with the resident and visiting pets issues that you have in your facility. Staffing requirements. Hold on here. I missed one. Chapter 9. I flipped over page too many. Subchapter 9, emissions and discharges. 9-1B says a current medical record and medical report and a medical assessment by the participant's physician of the participant medical condition shall be obtained within 5 days. There goes back to that 5 days piece. Some people come in there and they don't have any medical issues and they don't have a physician. So that's where you come up with paragraph D that says if a participant is not under a physician's care nor is taking any medications, the center may substitute a nursing assessment by a registered nurse for the medical assessment required in subsection B, which I just mentioned. Okay. 9-2A talks about discharge. Says a participant, his or her family member, guardian, or a representative shall be given a minimum of 2 weeks notice of the center's intent to terminate services to the participant unless continued attendance would infringe on the safety or well-being of the other participants or staff. That's a fairly common exception. Okay, now moving on to subchapter 11, staffing requirements. Staffing requirements, paragraph 1A says that you'll have a director who's given the authority to manage and implement the daycare program. Paragraph 2 says you'll employ additional staff such as nurses, therapists, consultants, drivers as needed. Paragraph 7 says each paid daycare center staff person, professional or non-professional, shall arrange for an employee examination within 72 hours of employment, which shall include but not be limited to a TB skin test. Again, I mentioned this earlier in the nursing home piece that they've got 30 days to do that in the nursing home. It makes very little sense that it's 72 hours in adult daycare where these people are up and around walking, and you've got really sick people in nursing homes, and you allow these people to come in and work for 30 days before they get their health check. Very interesting lobbying that goes on. 11-2A, staff ratios. This is more numbers. So there shall be provided a sufficient number of direct care staff on duty at all times to meet the needs of each participant. That's the overriding statement. There shall be a minimum of 1 full-time equivalent direct care staff person for every 8 participants who are present, and 1 additional direct care staff person for a major portion of 8 additional participants present. Paragraph B says there shall be at least 2 responsible persons at the center when participants are present, and 1 shall be a staff member. And then they've defined the staff qualifications for the director, which very much mirrors the qualifications that we have, with the exception of we've added the testing and that sort of thing, and the training that we provide for you. 11-3J says direct care paid staff shall be at least 18 years of age and qualified for the position held. That's where we get into this difference between a daycare aide and a CNA. A CNA, you can be a CNA at the age of 16, but you cannot be a direct care aide in adult daycare until you're 18. That's paragraph J. Paragraph K says the drivers have to have a valid and current state driver's license, appropriate for their position, a safe driving record, and training in first aid and CPR. Safe driving record is subject to interpretation, and training in first aid and CPR, that is not the last time you're going to see those words, training in first aid. That does not say certification in first aid or CPR. It does not say it. It says you're trained. So keep that in mind, that that's the words that are used. And again, goes back to lobbying. 11-4A through D, it talks about orientation and training. Says you have to have a general orientation to the program, your policies, fire safety, and emergency procedures. I can't imagine in Oklahoma not having tornado practices and that sort of thing. In-service training for each staff shall be provided quarterly. And everyone has to be competent and all that sort of thing. And documentation of attendance and content for all orientation and training shall be maintained by the center, or it didn't happen. If you don't document it, it didn't happen, right? 11-5, personnel records, individual personnel records for both paid and volunteer staff counted in the staffing ratio. Again, they require a personnel record for your volunteers if you're counting them. If you're not counting them, I suppose you don't have to, but that's what it says there. Moving right along, chapter 13, subchapter 13, 13-1-3A talks about planned activities, as the adult daycare center shall provide planned operations with a minimum planned activities during at least 1/2 of daily operations with a minimum of 4 hours of planned activities. That's kind of a definition that you probably need to have. Paragraph E says a monthly schedule of activities shall be planned and displayed prior to the first day of the month. Paragraph 5F says menus shall be planned and written for a minimum of a 2-week cycle if meals are prepared on site. Some of these centers do not provide their meals on site. They cater them in. So in that case, they do not have to have that written and published on this 2-week cycle. If they're preparing them on site, they do. Emergencies and first aid. Let's see, where are we? 15-6B. Is that where I'm at? No, I'm on 13-1-6C. All staff shall be knowledgeable about the emergency plan. Again, I mentioned it as a tornado area that we can't imagine not being. Paragraph G says there shall be at least one staff person on duty at all times who is, as I mentioned before, trained in CPR, does not say certified. Paragraph K says the provider shall have available a room for participants who require removal from the group due to temporary illness. So that's another requirement for the facility to have something like that. 13-2, paragraph 2A says participants shall be encouraged to retain and administer their own medications while attending the adult daycare program. And paragraph B says that when they've been determined to be unable to be responsible, there's procedures for that. The medications are retained in a safe, secure, locked area, and medications maintained by the center shall be retained in the containers which they were dispensed from the pharmacy. It means you can't put them in baggies, aluminum foil, or whatever. They have to be labeled with the participant's full name, the name and strength of the medication, and they may not be administered without an order from a physician. And physicians' phone orders may only be taken by a licensed nurse. And paragraph XV, that's 15, the administration and storage medication system shall be reviewed by a licensed nurse not less than every 3 months. Paragraph 17, XVII, documentation of medications administered shall be done within 1 hour after administration of medication. Sounds fairly familiar. In paragraph 18, records of all Schedule II drugs shall be maintained as well. 13-3, participant records. You should be really familiar with what goes into their records and that sort of thing. Subchapter 15 talks about the physical facility. Interesting changes here. Room temperatures shall be maintained between 68 degrees Fahrenheit and 85 degrees Fahrenheit. I got a range there for you to keep them in the temperature range. 15-3, space requirements. You have to have a minimum of 40 square feet of space for each participant, excluding hallways, storage areas, offices, restrooms, and kitchens. Can't count that stuff. 15-6B says hand washing facilities in bathrooms and kitchens shall at all times be supplied with soap and disposable towels. So we don't dry our hands on a towel that someone left dirty stuff on. Makes sense. Fire safety. 15-7D says all fires shall be reported to the licensing agency, that's the health department, within 72 hours. Fires causing injury or death shall be reported immediately, and a written report to the department shall follow a telephone report. So that concludes the rules. The statutes are even thinner, but we'll go through those quickly. Definitions are the same ones we covered, so we won't go through those again, but they are re-hit upon. Paragraph 1-873 says the license for your center has to be issued by the Department of Health, and it expires, paragraph C4, on July 31st of each year. Paragraph E says local health, fire, and building codes relating to adult daycare centers shall be classified as an education use group as opposed to something like a more stringent healthcare environment like a hospital or clinic. So it's a education use group, and again, your lobbyist got that in for you. 1-875, the State Department of Health shall at least annually and whenever deemed necessary inspect adult daycare centers. That's a repeat also. Discontinuance of operation of a center. If adult daycare center ceases operations, the center shall notify the participants in writing of its intention to do so at least 30 days prior to the effective date of closure. Unlawful operation, paragraph 878, paragraph B and E and F. Let's go to paragraph B. Any person who has been determined by the State Department of Health to have violated any provisions of the Adult Daycare Act or any rule may be liable for an administrative penalty of not more than $500 for each day that the violation continues. Paragraph E says any person who violates the provisions of this shall be guilty of a misdemeanor, and each day a violation occurs shall constitute a separate violation, and the Attorney General or someone can bring charges against someone for any of these items. So that actually concludes the adult daycare portion, and it actually finishes me with all of them. And I wish you all good luck with the state exams, and after that with the NAB exams if they're applicable to you. And good luck. We'll see you.